Hey guys, we're here in Wheeler's Fish Bathroom today to talk about kids' home care. We are a family dentist, so we are dentistry for adults and children. So I wanted to touch on children's diets, different products for kids, and how to care for their teeth at every age. So the first thing I want to talk about is plaque control, which comes down to brushing and flossing. When that first tooth comes in, you want to make sure you brush it, either with a wet washcloth or a toothbrush with a little bit of xylitol on it. I would start using fluoride right around a year, but just a very tiny amount, just a grain of rice size amount of fluoride. I like to use fluoride at night and then a xylitol toothpaste in the morning. So Wheeler's going to show us the different toothpaste that we like to use. So Burt's Bees is one of our favorite, the kind with fluoride. For the kids, it doesn't have a lot of the added dyes, but it also tastes really good. The other one we really like to use is Tom's. It's the Tom's with fluoride. It's called Silly Strawberry, dye-free as well. So the other toothpaste we really like is the Spry Kids toothpaste. So when you read the back of it, the list of ingredients are purified water, xylitol, calcium glyphosate, cellulose gum, grapefruit seed extract. So there's just not a ton of extra ingredients in it. It is fluoride free, so I try to let my kids brush in the morning by themselves using this so that they don't get too much fluoride in their mouths. And then I brush at night with the fluoridated toothpaste. So once they're older than 3, I like to use a pea-sized amount of the fluoridated toothpaste, just make sure they can spit it out afterwards. For toothbrushes, I really love the Sonicare Kids toothbrush. So you can see it right here. This is Wheeler's. So it's an electric toothbrush. It has the docking station, it has the removable head, and it vibrates when it works. So it does a really good job of cleaning his teeth and doing it efficiently, since he usually isn't still for that long to let me brush. For flossers, we really love this Firefly Flossers brand that I found on Amazon. So they are easy to use, they don't fray very easily, so we get a lot of uses out of them. You can just rinse it off and use it again the next night. Usually we'll use it for like a week or 2 before we throw it out, and then he can really bite it into place. So flossing is really important for kids from the minute their first teeth come in. Just getting them used to it so they don't get upset when you do it later on. Flossing anywhere, even when the teeth don't meet, still making sure to clean the sides of those teeth, because the toothbrush, like we've talked about before, is only getting the tops, the outside, and the inside. So the floss is really getting the sides of the teeth and where they touch. So the other really critical thing to consider with kids' home care with their teeth is their diet. So avoiding really sugary foods. So a low sugar diet is very important, but avoiding a lot of the foods that have hidden sugars in them. So fruit snacks are a huge culprit. Dried fruit, like dried mango, dried pineapple, avoid that. That's gonna act just like a sticky candy. It's gonna stick in their grooves. It's gonna be very hard to get out. We always say if you're gonna give candy, because we all need bribes right now for our kids, stick to chocolate. And that is something that's going to wash off. Their saliva is going to get it off. The water they drink is going to rinse it off. Always avoid juices, avoid sodas, avoid sports drinks. Try to stick to just a little bit of milk, always making sure you brush after you drink that. They brush after they drink that, and then water most importantly. So the last thing I want to talk about is the first time they should go to the dentist. So usually they can't sit through a full appointment until they're at least 2.5. So if you want to bring them in earlier, you can bring them to your cleaning appointment, just so they can see that it's not something scary. Make sure you're not saying needle, hurt, any of those bad negative connotations that dentist has to your kids. So our amazing hygienist Danielle wrote up a whole article that I'm going to post on our blog about how to care for your kids' teeth, when their first dental visit should be, different dietary suggestions, and then what goes on at the first dental appointments. So if you want to check that out, I'll put a link in my bio to her blog article. Thanks, and DM me if you have any questions.